Thank you, Ms. Melinda. Today, we are pleased to welcome you to our Individual and Family Supports webinar. Our presenters are Ms. Tammy Lewis and Ms. Alicia Poussin with Imcal's Developmental Disabilities Division. I will let them introduce themselves. As a reminder, this webinar is being recorded and all lines are muted, so please put your questions in the chat box. However, we ask that you hold all questions until the end of the webinar. With that being said, I ask you to give your full attention to Ms. Lewis and Ms. Poussin. Welcome, y'all.
Yes. Good morning. My name is Tammy Lewis, and I'm the Family Support Supervisor in our office. I have been the supervisor for the past 15 years. I have worked for Imcal for the past 26 years. And prior to that, I've had over 10 years experience in behavioral health services.
Hi, good morning. My name is Alicia Poussin. I am a community support professional in the Family Support Unit. I've been in this position for 9 years. And prior to that, I worked for support coordination.
Welcome, ladies.
Thank you so much.
So what is family support? The Individual and Family Support Program is administered by the Developmental Disabilities Division of Imperial Calcasieu Human Services Authority. We do serve the 5 parish area. That's Calcasieu, Cameron, Jeff Davis, Beauregard, and Allen. We are funded by Act 378, and we exist to meet needs that are not covered by other resources. And when I say needs that aren't covered by other resources, for example, if someone would contact our office and say they were asking for a personal care attendant and they receive Medicaid and they're a child, they can receive EPSDT services. And so that would need to be utilized because it's a service that is available through Medicaid. For adults over the age of 21, there is a service called LTPCS. It's a Medicaid funded service for PCA as well. So those are 2 examples in which you would need to utilize those services first. Sometimes these services aren't enough to meet an individual's needs. And if they're receiving the max number of hours, then they can certainly contact our office and request additional supports if those are not enough to meet the individual's needs. Who can benefit? Any child under the age of 3 that is enrolled in Early Steps, they have to have an active IFSP, and they do have a support coordinator. They can request services through our family support program. They are eligible after at 2 years, 6 months, they go through eligibility in our office if the family so chooses to do so. Then they would start the eligibility process with Imcal in our entry unit division. If someone is receiving services, actively receiving services, they will continue to receive those services while they were going through eligibility. Those services will not stop. They have to have, an individual has to have a current statement of approval that is through our eligibility unit. Our eligibility unit determines statement of approvals. So those are for individuals over the age of 3. If you have a question about if you have a current SOA, I'll be happy to answer that. You can call me and I can look that up for you, or you can email me and you'll get that information later on in the presentation. This funding is not available for those that are living in group homes or nursing homes. It's only available for individuals that are living in the community, because the sole purpose of our family support program is to assist families in the community. That's what we want. We want our families in the community. We don't want them in a nursing home or a community home. We want them in their home with their loved ones. And so that is the whole purpose of our family support program, is to assist our families and loved ones to stay in their homes. Okay, how can someone get help through individual and family support? A request for assistance must be made to the individual and family support supervisor, that would be me, via email or phone. And the number that is listed there is my direct line. So you're not going to be getting a receptionist, you will be getting me. I ask that if I don't answer the phone, please leave a detailed voicemail, because I do stay on the phone a lot answering phone calls. So please leave me a detailed message. Don't just hang up, and I will call you back. Our requests, any family support requests, they can originate through different sources. Of course, it can originate with the family member or the individual themselves, provider agency, support coordinator, or even through our entry unit process. I do get a lot of requests for individuals that come through entry unit. While they're going through entry unit, the entry unit asks them about needs that they have that aren't met, and that will generate requests, and they do come to me from the entry unit supervisor. So I do get those for individuals that are going through entry and are needing something through family support. What happens after that, after I get the request? So once a priority is established, the request is assigned to a CSP. And we'll go over priorities in a moment later on in this presentation. The community service professional will then contact the family to get additional information. So they're going to need more information about a request. For example, if someone were to request a fence, let's say you were needing a fence, then there's going to be more information that we're going to need. We're going to need bids. We're going to need information from you guys to see what it is you're actually requesting and the cost, so that when we present it, we'll have all the information needed. For those individuals that do not have waiver, we need to complete a plan of support. So my community service professionals will contact you to either go to your home or to come to our office to complete a plan of support, to get more information, to see what's going on with the individual, what needs they have, what are they receiving, what are they getting, what is lacking in the things that they need. So they complete a plan of support if needed. Once the plan of support is completed and all the information is received that is needed to move forward to our committee, our family support committee. And our family support committee meets every Tuesday at 10 o'clock. So we do meet once a week, and we present the priorities. Also, when a priority is presented, our families have the choice to present their own requests, or they can have the community service professional present it for them. But you do have the right to present your own request if you so choose to do so. Once the request is presented to the committee, it's either going to be approved, and you'll see on the side it says in whole or in part. So you may request something and it may be approved in whole, or it may not be approved in whole. You may have partial, what we call partial approval. Or it's pended. It could be pended if there is not enough information to make a determination. The committee may have the community service professional go back and ask additional questions. They may have questions that were not answered. So the CSP will go back, gather the information from the family before they represent, or it may be denied. If it is approved in part or it's denied, you can appeal those decisions, and you would have appeal rights that would be given to you. You would have 30 days to appeal the decision. So it would be a month from when the decision was made. CSP then notifies the family of the committee's decision, and a decision notice is sent within 10 days. Now, this is not the appeal that I'm talking about. It's just a decision. You get it, you receive it stating what the outcome was. And then, like I said, once you have, if you were denied or you were approved in part, you do have the right to appeal those decisions.
So this current slide that you see on the screen here is the priority instrument that is used in every request that we receive in our unit. The request is assigned a priority based on information provided to the supervisor. So when you email Tammy or call Tammy and speak with her about whatever you're requesting, she takes information from you and assigns the request a priority based on the information that she's given. There are 4 priorities on the instrument. I'm not sure if it's actually big enough for you guys to see. It's kind of small on our end, but I'll go through and explain them. A priority 1 request is an emergency. It involves things like utility disconnections, eviction notices, protective services involvement, risk of being removed from the home, death of a caregiver or a caregiver's inability to continue to provide care for someone. Priority 2 is things like incontinence supplies for adults, environmental modifications like a ramp or an accessible shower for someone to take a bath. Priority 3 is to maintain, and I'll go back and elaborate on that. Priority 3 is to maintain the individual's current state of affairs, and it's things like an iPad for communication that has a letter from a supporting professional saying why they need it, what it's used for, those kinds of things. Another option for priority 3 is work uniforms that were paid for prior to requesting. So maybe mom paid for them, but she's requesting reimbursement. Priority 4 is dental braces, like for cosmetic reasons. So priority 4 is anything to do with quality of life.
I got all of them, but
So again, that one is dental braces for cosmetic reasons, summer camp, maybe things like a trampoline, those kinds of things.
Excuse me, can y'all mute your mics? We can hear somebody talking on the webinar.
I took care of it.
Thank you.
Again, I said I would go back and kind of explain the terms that I was using for the priorities. So priority 2 is to prevent a deterioration in the individual's health or in their ability to maintain living in the community. A priority 3, again, is to maintain what their current level. And a priority 4 is to enhance. So again, that's those different priorities. Once a request is called into Tammy, she assigns those a priority and then gives that to one of us as a CSP. However, that does not mean that the priority can't change as we gather information. So if we speak to the family and we see, well, they need a fence because their family member is running off to the street, then that could be a different priority.
And also, sometimes people have more than one request. They may have multiple requests. We prioritize each request, so it's not jumbled into one request. So if you are requesting a fence and say you're requesting diapers, those are 2 different priorities. So we do prioritize according to request. We don't, everything is done individually.
This is the second page of the priority instrument that you're seeing. So the first part, the chart portion of it, was the first page. This is just the back page where you fill in the individual's name, date, fiscal year, who completed the priority instrument, and then Tammy will sign off on it and then establish the final priority level. So Tammy mentioned the 4 things that could happen when a request is presented. If the request is approved, the CSP, which is me or 2 other individuals in our office, prepares a contract and then sends it to either the individual or the responsible party for signatures. Our preferred method of doing this is via DocuSign, but mail is used if needed or if the family does not have an email address. Once the contract is signed, it goes to our financial intermediary. Once the financial intermediary sends the contract back executed, which means that it has a contract number, basically, then billing or purchases are able to begin. So we can't purchase any items to be shipped to you, whether it's diapers, iPads, whatever the case may be, or process any reimbursements until we have this number. If the request is pending, again, Tammy spoke about this a few minutes ago. If we take something to committee and it's presented and the committee asks for additional information, the CSP will gather the information requested and represent to the committee as soon as possible. So if for some reason you have a request and one of us contacts you and says the committee would like additional information, it helps if you can get us that information as soon as possible, because we're trying to move through the process of getting you a determination as soon as possible as well. Once we go back to committee, if the information is sufficient, a decision will be made. And if there are still questions, the request can again be pended and the process repeats. If the request is denied, the CSP prepares the IFS decision notice, which you get no matter what the decision is, and the appeal rights, and sends this to the family. The timeline to appeal is 30 days from the date on the IFS decision notice. If an appeal is initiated, it is heard by an administrative law judge. If Imcal wins the appeal, the request is not funded. But if the individual or family wins the appeal, the request is funded.
And this administrative law judge is not someone that works for Imcal. They're not even in our office. They're located in Baton Rouge.
Also, in reference to the last slide also as well, if you as a family member do appeal and you need assistance working through that process to get to the point of the actual appeal, we will as CSPs assist with getting paperwork turned in and things like that. But there are also advocates, I believe, through administrative law that also will assist with the actual appeal if requested. Finally, oh, I just realized we're back on the denial slide. Okay. Other considerations, all priorities are not necessarily funded at the same time. So a lot of times we get different priorities that come in at different points of the fiscal year. And what happens is, as we allocate funding or our budget gets less, a decision may be made to only fund priority 2s or priority 1s at the time based on the amount of funding, because we get one budget that has to last us an entire fiscal year. So again, the priorities may be funded, priorities being funded may change multiple times, and it's at the discretion of the division director, Dr. Mesh. Consideration is also given to the overall budget. So if we get down to a certain number and he thinks that we need to stop there in case that we have emergencies that come up, he can say, okay, we're only funding this priority at this time. But that can change over days or weeks depending on whether money goes back into the budget, because sometimes individuals do not spend the entirety of the funding that is allocated to them. So when that happens, that funding is removed and goes back into the general budget to be reallocated to other individuals.
Does anyone have any questions?
Are non-US citizens eligible for assistance?
When you say non-US citizens, do they have a green card or do they have a social security card?
No.
No.
No, they need to have a social security card. They have to have
Okay. There's another question that says, I missed a lot, but I will go back and watch if able to. Yes, you can do that. We'll have the recording posted sometime next week so you can go back and rewatch. Yes.
Sure. There's a question here about the appeals process. Is that 30 calendar days or business days? And it's 30 calendar days.
And it said, did I hear you say that ALJ, the administrative law judge, has advocates to help people with the paperwork?
Yes, ma'am. But if you're appealing a decision that we made, we as CSPs will also help to get the paperwork turned in to initiate that process. So you can actually start by calling our office and saying, hey, I want to appeal, but I need assistance completing the paperwork.
And these are great questions.
They are.
And
And I also wanted to say, I'm sorry, Wallace, when Alicia was talking about diapers, everybody knows that Medicaid waivers, the Medicaid waivers, they're paying for diapers now. But we have individuals that, you know, they're only allocated a certain amount of money, and the individuals are needing more diapers than what's allocated through their waiver. They most certainly can request diapers through family support if it's not enough to meet their needs. So I just wanted to say that as well.
Anybody else have any questions? You could raise your hand and I'll let you talk, or you can use the chat box. And there's a thing that says, can whites be covered too?
Yes, ma'am. That can be a family support request. Absolutely.
And would it need
says
to be
question.
done monthly, Tammy, the request for additional diapers?
No, you're asking, would they have to request each month for that?
Right,
No.
for the additional.
No, they would
Okay.
not. They could do a one-time request, and then we would figure out what wasn't being met. And that's what we would ask for at one time. They wouldn't have to keep coming back to family support each month. No.
Okay, well, that's good to know. Thank you.
You're welcome.
And then there's a question that says, will y'all be sending the link to rewatch? Yes, we'll have it on our YouTube page sometime next week. Now, keep in mind, Imperial Calcasieu Human Services Authority, Developmental Disabilities Division Services Region 5, the Southwest Louisiana area. So if you are on and you're from another region, there is an office that would cover your region. So you can contact us at Families Help Families if you need help with finding that office, or you can contact Tammy and Alicia, and they can help you find it as well.
Absolutely.
Yes, and I know it's a lot of information in a short amount of time. Please, you have my email address, you have my phone number. Please reach out to me with any questions that you may have.
Okay. Well, we would like to thank you for attending the webinar.
Well, thank y'all for having us.
Yes, and providing us with such important information. If you have any additional questions, you can always call our office at 337-436-2570 or email us at info@FHFSWLA.org. We ask that you please complete the survey from today's webinar. We will be emailing it to you. And thank you and have a great day.
Thank you.
Thank y'all. We appreciate it.
You're welcome.